Hello, lovely prackies. I wanted to jump on today and do this week's 2-minute tutorial, which is a follow-up on neurological from last week. So, yeah, really huge area, and an area that a lot of people are overlooking and not doing very well because they kind of feel really stumped with it, which is totally understandable because, as I said, it is a really big area, and also it's probably a really good opportunity then to remind you guys that, like everything, it's not we're not there to diagnose neurological conditions. We're not there to really deep dive and give people a diagnosis and things like that, or even to direct neurologists and things like that. We're simply there to be part of the conversation. But obviously, when I say that, please don't underestimate what you can do in a situation with a neurological presentation. Okay, so some of the things that people get caught up as well with is that when would we actually consider doing a neurological examination? Now, obviously, there's two different scenarios in which that we would do the neurological physical examination. One is which when we have a patient presenting with us that's already had a diagnosis. So, whether it's Parkinson's, whether it's MS, whether it's one of the palsies, even Bell's palsy, which is obviously more acute and less serious. Possibly, hopefully. Okay, so obviously we've got that. Now, when we're doing our quick neurological tests and choosing the appropriate ones, the reason why we're doing them then is to sort of track progress of any treatment plans that you've been undertaking. Also to sort of check to see the way signs and symptoms are progressing with specialist medications as well, and also to track any degeneration of their condition in that respect as well. And that's really important, because then there can be the conversation going back to a specialist and going basically in a respectful way, hey, this is what sort of come up when I've been doing my checks. Are you aware of it? And what can we do about it, sort of thing. The other time that you would use your neurological physical examinations is when someone has not got a neurological diagnosis of any type, but they're presenting with signs and symptoms that suggest there could be a problem. Now, as I sort of start talking through some of these signs and symptoms, you'll quickly realize that a lot of them could be due to a lot of other issues that are going on with the person. So, we never jump straight to anything quite well, look, we'd never tell someone that they have cancer before really going down the track, and even then someone else would be diagnosing that. So the same with neurological. We are there to gather the information, to do the appropriate tests, and then refer on if we can't get our head around what's going on. So obviously some of the things, when we're thinking about neurological things, we're thinking about things that are nervy in nature. So, obviously when we are thinking back to all of our anatomy and physiology training, and we think about the neurological system, obviously if someone's presenting with anything like numbness or tingling, that could possibly be neurological in nature. We're thinking about dizziness and vertigo. We know that when the cranial nerve 12 is involved, and some of the other cranial nerves as well, then we have a difficulty swallowing. If someone can't stick their tongue out straight, then that's a cranial nerve issue as well. Loss of coordination as well is a really big one, and headaches and head injuries could possibly be due to neurological issues. So these are all things, tremors as well, obviously, and shaking, and changes in gait that could walking could actually be. Is it muscular, or is there a neurological issue in which they simply can't can't walk properly. So these are all things that would be little kind of like a little ding. Oh, maybe I want to check some of those things, as well as doing obviously your comprehensive case taking to make sure that headache isn't dehydration, it isn't liver and detoxification issues, gut issues, food allergies, have they got a cold or a flu? So, all of the other things as well. But we have a really amazing opportunity to serve our patients when we can deep dive into some of these other things as well. So they are some things to think about with our neurological examination. Now, I'm actually spending quite a lot of time running over a lot of this stuff in the workshops, as well as obviously how to do them. We're going to be working through cranial nerves. We're going to be doing assessing different types of gaits. We're going to be testing reflexes and things like that, and touching on numbness and tingling and which areas of the spine that is related to. It's a huge area to cover, and as I mentioned, unless you're really going to be sort of deep diving and working alongside a neurologist and things like that and specializing in this areas, it's our job to be able to identify red flags and be able to refer on appropriately. So I'm really hoping that a lot of you guys can join me at the workshops. I've seen a few of you have jumped on, so you'll probably have to go back to the beginning. I've been talking about neurological signs and symptoms and what to look out for and why we do them, basically. So I'm really looking forward to seeing a lot of you at the workshops. They are filling, so jump on board. I think there's about a month until Brisbane, and then they kind of, they are weekly weekends after that. It's going to be a massive weekend. I'm getting in touch with everybody as well about the things to really brush up on before the weekend. And when I say brush up on, it's just really going over your anatomy and physiology notes that you've had from college, because on the weekend we are deep diving into all the examinations. It's very, very practical. The aim is for you guys to walk away with a really solid plan that you can take back to clinic and feel very, very confident. And so we will be touching on anatomy and physiology, but we will really just be spending most of our time learning the techniques and practicing them, because that's where the gold is. Okay, so have a little think about these neurological signs and symptoms that I've spoken about today, and think about where you can go further with serving your client and making sure that we are giving them the best possible service by checking these things. I will be checking back in, and I will be doing some more neurological teachings as well, and we'll be talking about a few different types of gait. We'll be talking about cranial nerves, and we'll be talking about reflexes. Okay, I've got a busy day. I'm sure you guys do too. I'll let you get on with it.